Hi, I am Dr. Renjisha. Renjisha. Renjisha.
Renjisha.
Yeah. Renjisha. Your Michael J. Okay.
Mar.
Mar.
Okay. M-A-R.
M-A-R. Okay. You are?
Sandra.
Sandra. Okay. So, which country you are from?
Taiwan. Colombia.
Germany, Colombia, Taiwan. Okay. So, today we are dealing with the Panchakarma introduction. Okay. So, we have divided Panchakarma into 3 portions. So, totally we will have 30 hours of class. Okay. So, my classes will be coming maybe in the second or third week. So, today I am giving an introduction. So, have you all heard about Panchakarma?
Yeah. Yes.
So, what is your
Panchakarma.
understanding regarding Panchakarma? Michael G.
So it's a cleansing technique. Pancha means 5, karma and actions. And we have like a preparation, then we have like the cleansing, and then we have like a building up again.
Okay.
We got like 5 different treatments. Especially, my understanding is that some of them are for a specific season.
She's just checking that minutes. Okay. Sandra Ji, what you think about Panchakarma?
I think it's that a toxin out of the body and that your organs and your body system back to the normal situation.
Okay. Okay, so somewhat all of you are correct. Okay. So Panchakarma means 5 action. Pancha, the word Pancha means 5 and the karma means action. Okay. So our action, what are our action? Like action means just it's a process. Okay. Something we are doing inside the body. Okay. So that is the word meaning. Okay. Then, so what are the 5 karmas? First one is Niruha. Niruha, that means Kashaya Vasti. Vamana, vomiting therapy. There are 2 slokas which denotes the Panchakarma. In Ashtanga Hridaya, Sutrasthana, Dividhopakramaniya Adhyaya, that is the 14th chapter of Ashtanga Hridaya Sutrasthana. So, Acharya Vagbhada is telling regarding Panchashodhana. Okay, so the meaning of Panchakarma and Panchashodhana is actually same. But different acharyas have mentioned different names for the same techniques and they have some small changes in their opinion also. Okay, so this is according to Ashtanga Hridaya. So they are telling Niruha, Vamana, Kaya Rekam, Shiro Rekam.
Acharyas are like masters.
Yes, Guru. Okay, so I think you heard about Susruta, Charaka. Okay, so one is Ashtanga Hridaya written by Vagbhada. Susruta wrote Susruta Samhita. It is basically given importance for the surgery part, and Charaka Samhita is written by Charaka Then actually it is written by Agnivesha. Acharya Agnivesha written the Charaka Samhita, and it is updated by the Charaka, but it is called as Charaka Samhita because as he updated, because maybe there will be a different Agnivesha Samhita will be there. It is somewhat similar to Charaka. Okay. So that is mainly giving more importance to the Chikilsa. Okay, like but treatment side. Okay, like everybody has told treatment. Chikilsa means treatment. Okay, like as Sushruta given importance for the surgery part, Acharya Charaka given importance for the treatment part. Like when you see different Acharyas has mentioned treatment in their own textbook. So when we compare, we feel like whatever mentioned by Acharya Charaka is more better. Okay. So in practical way maybe. Okay. And Ashtanga Hridaya and another textbook written by Vagbhada Acharya. So these Charakas to the Ashtanga Hridaya are known as Brihatrayis because it's a big treatise. Okay. Maybe some 1,000 adhyayas and slokas, something like that. So it's a very big textbook. So these three are mentioned as Brihatrayi. Brihat means big. Brihatrayi. Actually, I am just telling the basics only. These are not very important. But just understand that these textbooks are very important in Ayurveda.
Hridayam, H-R-D-A-Y-A-M, Hridayam.
Is it a book or it's a book like Ashtanga Hridaya?
Ashtanga Hridayam,
Yes.
Charaka Samhita, Sushruta Samhita.
Yes.
This one.
Okay.
So,
So,
notes. Oh, Ashtanga.
നിങ്ങൾക്ക് മനസ്സിലാവുന്നുണ്ട് എന്തെങ്കിലും ഉണ്ടെങ്കിൽ പറയണേ.
This is the straight.
കൈ ഒന്ന് പൊക്കിയാൽ മതി കേട്ടോ.
Shoot some.
In Ashtanga Hridaya Sutrasthana, 14th chapter, Acharya is telling about Panchashodhana. It is same as Panchakarma. Okay, see some people follow this system, some people follow Panchakarma, like another system. Okay, that I will tell you. There is only a small difference between those two.
So
Okay.
this is why the words are different, like Shiro Reka is same like Nasya, and this is like Raktamoksha.
Yes. Different Acharya denotes different words. Okay. So first one is Niruha. Niruha, Vamana, Kaya, Shiro, Rego, Asra, Visruti. Okay. Niruha means Kashayavasti. Vamana means inducing vomiting. Kaya Rega means inducing purgation. Shiro Rega means Nasya or putting nasal drops. Asra Visruti. Asra, the word Asra means blood. Asra Visruti means blood letting. Visruti. Okay, so these 5 are called Pancha Shodhana.
You mean blood letting is like that blood keep.
Yeah, blood letting means blood is taking out through different measures. Like we can use the leech. Leech is a small organism. So that we are using. It will catch and it will suck the blood. Then there is a some instrument you can use. Then you can prick it there. Then it will catch. So prachana. There are different ways for the bloodletting is there. So whatever is the specific condition of the patient, we are preferring whether we need to do bloodletting with a leech or with an instrument. That is purely depending upon that vaidya. Okay, and the condition of patient. Okay, നമ്മൾ പറയുന്നത് പഞ്ചകർമ്മ അഥവാ അല്ലെങ്കിൽ പഞ്ചശോധനം. അതായത് പല ആചാര്യത്തിന് മനസ്സിലാവുന്നില്ല. ചില ആചാര്യന്മാര് പഞ്ചകർമ്മം എന്നുള്ളതിനെ പഞ്ചശോധനം എന്ന് പറയുന്നു. അതിൽ വരുന്നത് നിരൂപകഷായവസ്തി, വമനം, വിരേചനം. അതായത് നമ്മൾ മെഡിസിൻ കൊടുത്തിട്ട് പർഗേഷൻ, ലൂസ് മോഷൻസ് ഇൻഡ്യൂസ് ചെയ്യുക. വോമിറ്റിംഗ് എന്ന് പറഞ്ഞാൽ അതുപോലെ തന്നെ നമ്മൾ മെഡിസിൻ കൊടുത്തിട്ട് ഛർദിപ്പിക്കുക ആളെ. അപ്പോൾ ശിരോരേഖ എന്ന് പറഞ്ഞു കഴിഞ്ഞാൽ, അല്ലെങ്കിൽ നസ്യ, ശിരോരേഖ എന്ന് പറഞ്ഞു കഴിഞ്ഞാൽ തലയിൽ നിന്നുള്ള എലിമിനേഷൻ എന്നാണ് അർത്ഥം, ശിരസ് എന്നുള്ള അർത്ഥത്തിൽ. അപ്പൊ അത് ഉദ്ദേശിക്കുന്നത് നസ്യ എന്ന് പറയുന്ന പ്രൊസീജിയറിനെ തന്നെയാണ്, വേറൊരു പേരിൽ മെൻഷൻ ചെയ്യുന്നത് മാത്രമേ ഉള്ളൂ. പിന്നെ കായരേഖ എന്ന് പറഞ്ഞത് ബോഡി എലിമിനേഷൻ. അപ്പൊ മൊത്തത്തിലുള്ള ബോഡി എന്നുള്ളൊരു എലിമിനേഷൻ വരുന്നത് വിരേചനത്തിലാണ്. അപ്പൊ വിരേചനത്തിന്റെ സിനോണിമാണത്. ഇനി അസ്രവിസ്മൃതി, അതാണ് നമ്മൾ ഈ പഞ്ചകർമ്മ ആൻഡ് പഞ്ചശോധന ആർ സം ടെക്നിക്സ് വി ആർ യൂസിങ് ടു ക്ലെൻസ് അവർ ബോഡി. ഓക്കെ, നമ്മുടെ ശരീരത്തിലുള്ള ദോഷങ്ങളെ, അതായത് ടോക്സിൻസിനെ പുറത്ത് കളയാനുള്ള സം ടെക്നിക്സ്, അതാണ് നമ്മൾ ഈ പറയുന്നത്. അതിൽ തന്നെ രണ്ട് അഭിപ്രായം ഉണ്ടെന്നാണ് ഞാൻ പറയുന്നത്. അസ്രവിസ്മൃതി. ദെൻ സോറി, രഞ്ജിഷ.
So this all 5 treatments are Panchakarma.
These 5 are called Panchashodhana.
Not Panchakarma, it's Panchashodhana.
Actually, basically both are same. Different acharyas are giving different names, that only. So when you go through the different textbook, you can see same things in a different names. So don't need to get confused. They are all, just understand the meaning. Okay, in which context he is telling. So it will be the same like the other acharyas are telling. Sometimes the word is the only difference. ശോധനം, അത് തന്നെ. Then പഞ്ചകർമ്മ. പഞ്ചകർമ്മ വമനം, രേചനം, നസ്യം, നിരൂഹശ്ച അനുവാസനം. ഏതാനി പഞ്ചകർമാണി പതിതാനി മുനീശ്വരഃ. So these are the 5 Panchakarma. I think it is
Which one is Vamana?
sorry,
Vamana.
Vamana means vomiting. Same.
It's the same.
Inducing vomiting. When you write inducing vomiting. Rechanam means virechanam, that is inducing purgation.
Reducing.
Inducing.
Inducing.
Like we are giving medicine, it's not a normal purgation. We are giving medicine to create purgation. Okay, that is why we are forcefully inducing or telling the body to eliminate its toxins.
Purgation is what?
To vomit.
Purgation means we are giving medicines and inducing loose bowels. You understand?
Lose what?
So wherever you see the term virejana or kayareka or just rejana, everything means Vaidya is giving some medicine and the patient is getting loose bowels. എന്തോ അല്ലല്ല സെയിം ആണ്. അതാ ഞാൻ പറയുന്നത്, നിങ്ങൾ പല പല സ്ഥലത്ത് വായിക്കുമ്പോൾ പല പല ടേംസ് ഉണ്ടാവും. അതൊക്കെ ഒരേ ഇതാണ്. പല ആചാര്യന്മാര് അവർക്ക് ഇഷ്ടമുള്ളത്. ഇപ്പൊ നമ്മള് എന്താ, ഇപ്പൊ ഒരാളുടെ പേര് അഭിജിത്ത് എന്നാണെങ്കിൽ വീട്ടിൽ മോനേന്ന് വിളിക്കും, വേറൊരാള് കുട്ടാന്ന് വിളിക്കും. ഈ ഡിഫറൻസേ ഉള്ളൂ. സത്യത്തിൽ അത് അഭിജിത്ത് തന്നെ, അത്രേ ഉള്ളൂ. കഷായ വസ്തു. See, most in the textbook it is mentioned like niruha. Nowhere it is mentioned like nowhere in the sense it's mentioned like kashaya vasti, but mainly acharyas use the word niruha. Or asthabana. Asthabana is also the synonym of kashaya vasti. Actually, vasti means enema. Okay, we are giving medicine through anal canal. That is actually mean by vasti. The term vasti means retaining. Retaining medicine. It can be oil, it can be decoction, it can be ghee, it can be anything. Soap. അങ്ങനെയൊന്നുമില്ല, അത് നമ്മൾ കോഫി എനിമയുണ്ട്, പല 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 എനിമയുണ്ട്. There are different sorts of enema.
So Kashaya Vasti and oil Vasti, and where is like bloodletting?
It's not mentioned.
Not mentioned in Panchakarma.
It's already fine.
Oh,
Already fine.
okay.
That's what I'm telling. These two acharyas are having different opinion, but actually this is also cleansing technique. Panchashodhana, what we already learned, that also cleansing technique. Every acharyas are having some sort of difference in their opinion.
Oh, this is from Charaka.
This is, I think, I don't remember the context now. Somebody else, I will tell you the reference later.
Kashaya Vasti is a derivative.
Kashaya Vasti.
Isana.
Sorry?
Vasti.
Kashaya Vasti.
Yeah.
Kashaya Vasti, you want to know what it is?
Yeah.
That means we are giving some decoction as enema through the anal canal. See, we will take each topic in detail. Okay. So, just now I am only giving an introduction only. So, doctor, from tomorrow onwards, Dr. Sajana will be taking with Virechana. Okay, she will start with Virechana. Dr. Hima will deal with the Nasya and Niruha, Srivasti. So she will also include Anuvasana, and later I will be taking Vamana. Okay, so each and everything will be taking in detail. Okay, so you don't need to think what it is. Just understand what it is for the basic knowledge only. Any doubts? Any doubts? Okay, so we can go through the introduction. Okay, so what is the importance of Panchakarma or Panchashodhana? Why we are doing this procedure?
To get rid of dosha?
Yeah, but I'm asking if it is, shall we manage the issues in an OP basis, just giving an internal medicine? Why we need to cleanse this? Cleanse the toxins.
Because our body is imbalanced.
Mm.
We need to get the body get balanced back to face our normal life.
Actually, the main thing is we don't want to reoperate. Reoperate. Like, see, once you did the treatment, from the next day, if you are getting the issues again,
Yes.
how it will?
It will happen.
Okay.
To remove the root cause.
Endo?
To remove the root cause of the root cause.
Other. Okay. So, if you are not removing the root cause, then only there is a chance of reoccurring is there. Okay. It will happen again. Okay. We are doing a treatment for 21 days. Okay. You treated, you spend your time, you spend your money, you got healed, you went back to your country.
Yeah.
After 1 month,
Same.
one day morning your symptoms are coming back. So that is
No.
not a good treatment.
Yes.
Okay, we call it Shuddha Chikitsa. Okay, if you are doing a treatment, it should be complete and it should have the proper benefit.
Okay.
Okay, so that proper benefit is the disease should not happen again.
What is Shuddha?
Shuddha means pure. Pure. If the treatment is pure, then that means it should not come again.
Shuddha? What is the word?
Shuddha Chikitsa. Shuddha Chikitsa. Chikitsa means treatment.
You write on the
Yeah.
board.
CHI.
Usually it's performed before the treatment.
Sorry?
The Panchakarma or the Panchashodhana, is it performed before starting the treatment or after starting?
Okay. So that's what we are going to tell in the introductory session. See, whenever a patient comes with a disease, every doctor want to do some Panchakarma procedure or Panchakarma techniques for that patient to avoid their root cause of that particular disease. Okay. So, if a patient coming for 14 days, 21 days, actually a doctor will be planning to implement any of the Panchakarma procedure. These 5 treatments we can't do for one patient. It's very difficult. Okay. Why it is very difficult? Each process needs a preparation. Okay. So you are coming one day. So immediately I am telling, come, let's go and do a Vamana. We can't do like that. Okay. We need preparation. Okay. So നമ്മളൊരു പഞ്ചകർമ്മ ട്രീറ്റ്മെന്റ് ചെയ്യണമെങ്കിൽ അവരെന്ത് ചെയ്യണം? അതിനു വേണ്ടി പ്രിപ്പയർ ചെയ്യണം. ഓക്കെ.
Not every patient has the same treatment, right?
Because see, we will be selecting any of the Panchakarma procedure for them according to their health issue. Okay. So whatever health issue is there, which one will be suiting? It's like a permutation combination. Like this issues will have, we can do this and this. Other issues can do this and this. Okay. It purely depending upon the condition of patient. Okay. So, നമ്മൾ അത് ചെയ്യുമ്പോൾ we need a preparatory stage. Okay. So, within one day we can't do a Panchakarma, any technique for one patient. We need a preparatory stage. It is something like a surgery. So, if you are going to do a surgery, you need to get admitted in the hospital few days back itself. They will monitor your vitals. They will conclude that this particular patient is eligible. It's eligible to perform this surgery. Okay, they will certify, then only you can enter to the surgery room. Okay, that monitoring, something here we are doing, how we are preparing the patient body so that we can implement the Panchakarma procedure. Okay, so what is that preparation?
To see.
Yeah, actually, yeah, these all are preparations, like whatever total is. We do whatever treatments, dhara, water pouring, medicated decoction, snehana and swedana is considered as the preparatory stage. For what purpose we are actually preparing?
To get the toxins out of the tissue?
Yeah, because see, in every patient, these toxins will be located in different parts of the body. Okay. See, നമുക്ക് ഇപ്പോൾ പറയാൻ പറ്റില്ല ടോക്സിൻസ് ഒക്കെ എന്നാൽ നിങ്ങൾ വേഗം ചെയ്തോളൂ, ഞാനിപ്പോൾ റെഡി ആയിട്ടിരിക്കുകയാണ്, ഇപ്പോൾ വരാം. It's not like that. Somewhere else. We don't know where it is. It's all are a concept. Okay. So you know when some function is not happening good, there is something blocking it. It's a common sense. Okay. But we can't go and see the toxins present there. It's not possible. It can be some byproducts. It can be some chemicals. It can be anything. It's not a very huge mass, something like a fibroid or some megaly. It's sitting inside and you can surgery and take it out. So this is toxins. This is not possible. Okay, this is a concept. You are assessing. Okay, with the patient, when we are doing some treatment, patient is getting some good result. That means the toxins are clearing from there so that the normal function is re-established. That is how we are assessing that the toxins have removed from there and the normal mechanism started in action. Okay, so we are getting this inference from the patient. Patient should tell. Okay, if there is a reddish color, this should go and the normal color should come. Okay, see, that is what darshanam, sparshanam, prashnam, like we are getting those assessments from talking to the patient, from the seeing. We are through our senses, we are seeing all the changes. Swelling has reduced.
Yeah.
Through the touch, the temperature has gone. Okay, the thickness has gone. Okay, these are the assessment what we do, whether our treatment is working or not. Okay, so all these toxins are there. That is why the patient is having some issues. Okay, so sometimes these toxins can be in skin, sometimes it can be in liver, sometimes it can be in spleen, it can be in brain. So what if you want to clear it at once? We can perform the Panchakarma one time only. We can't do everyday Panchakarma. So if we want to eliminate the toxins first, what we need to do? We need to collect everything. Okay, first you need to collect the whole toxins to one side. Okay, so for that collection, actually you are doing preparation.
You mean that the toxin to one side is preparation?
Sorry?
When you let the toxin to the one side, like mouth or somewhere else, is
Collection of toxins.
okay. It's what you mean the preparation for the
Yeah, actually we are doing some treatments. Like when you do first 1 week will be the preparatory stage. So that time we basically do some treatments. Sometimes we do oil massage. Sometimes we do different techniques for fermentation, like to sweat the patient. So these all techniques are actually a preparatory stage or preparatory procedures to implement a Panchakarma procedure in that particular patient. Okay, by doing this preparatory procedure, what is actually happening inside the patient body is the toxins are getting liquefied and that moving through the channels and coming and collecting in any common part of the gut.
Usually it's the gut where all the toxins we tend to accumulate only, right?
Yeah. Then after the collection of toxins, the doctor will be deciding where the toxins have got collected. If it is the stomach, we can do the vomiting. If it is the lower intestine or small intestine, Niruha or Vasti, enema procedures will be better. If more toxins are there in the chest part, Vamana will be better. If more toxins are there in the upper part, like above neck portion, Nasya will be the best option.
So it's not all the time the gut. It's
No.
The toxins can be in one place, maybe in the chest, and then we do vomiting in the gut. Then we do like the okay.
See, this is now what I told in the chest means it's a simple. Okay. Sometimes if their condition changes.
Yes.
Okay. See, in Vamana, one thing there is we need a good preparation. Okay.
Yeah.
Some treatments. Some need just in few days we can do. Okay. Not a very long preparation is not needed. And see that how much time you need preparation, that is also purely depending upon the patient condition. So we should get that symptoms from the patient. They are ready to perform a Panchakarma. If they don't have any mental strength, that is Sattva Bala, we can't implement any of the Panchakarma to them. That it will be later it will be a problem to you only.
Okay.
Okay, so sometimes by look they will be fine, but if while history taking or when you talk with the patient, you are feeling this patient is mentally very she can't perform, so don't try anything. It's of waste.
Oh.
Okay, so then the patient will get collapsed, then you will get a bad name. Okay, so better treat those patients with only OP medicine. Take time. Okay, tell them you are not eligible for a Panchakarma at this moment. We can do it later. Please wait. Your toxins are not ready to eliminate. Let me collect it first. So give me some time. Okay, so don't take a fast decision.
So Sattva Bala?
Sattva. Sattva Bala means mental strength.
And how do we know they are eligible for സത്വഗുണം ഉണ്ടാക്കണം നമുക്ക്?
എന്തോ
എല്ലാ പേഴ്സണും ആ ഒരു സാത്വിക ലെവൽ ഉണ്ടാവുമോ?
ഉണ്ടാവില്ല. അത് നമ്മൾ അവരെ അസസ് ചെയ്യുമ്പോഴേ നമുക്കത് അറിയാൻ പറ്റുള്ളൂ. അത് നമുക്ക് അവർ see first as a therapist also when we talk with the patient we can assess like
ആ ദോഷങ്ങൾ മാറിക്കഴിഞ്ഞാൽ അവർ കുറച്ചുകൂടി മെന്റലി ഇതാവുന്നു.
no, not like that. See, sometimes they may be mentally very weak. They have some issues in the like recently or something. So sometimes they will not be able to do the Panchakarma at that moment. Maybe later we can do. See,
മെന്റൽ ലെവലിലെ ട്രോമ അതുമാതിരിയുള്ള കാര്യങ്ങളല്ലോ
it
ആൻസൈറ്റി
can be anything. See, every patient is different. Okay, so where they live, their family atmosphere, their work experience, everything is different. So we need to assess. Don't judge as a common. Like individual, give individual assessment. Okay, that is very much needed. And see, don't think I want to give a Panchakarma to 100 people who are coming to me. Not like that.
So how do we know the patients are well prepared? Is that well prepared?
Yeah, actually when we go through in each treatment in detail, we will tell you who all are eligible to perform this particular treatment later.
Okay, so you're saying that we need to collect all the toxins to certain part of the body.
Yes.
So Abhyanga and Svedana know this preparation
Yes.
help with that, right?
Actually, Snehana, it's called Snehana. Snehana means spoliation.
Uh-huh.
Snehana. Snehana, that particular term means something which binds together. Okay, or something which gives lubrication. Okay, Sneha can be oil, ghee. Okay.
This is why patients in the preparation drink ghee.
Yes. So I will take all this session later. Like regarding the ghee, we will take it later. Now I'm just giving a overall picture only. So when they take different portion, you want to know which part they are taking. Okay, if you get a whole idea, sometimes they will talk about Vasti, some other doctor will take about Vamana. So you have to know these are all coming under the main heading of Panchakarma. These are the techniques, this is the preparation, this is the fermentation. You have to know the words just to familiarize.
So Snehana is drinking oil or ghee?
Yeah. Actually, not we can't say like drinking, just giving. Okay, like it can be giving internally, it can be externally, both internal or external or both. We can give internally ghee, we can do external oil massage also. Both are coming under Snehana.
So this preparation, how do we know if this is the right preparation, or shall we always use Snehana?
Yeah, actually, whenever a patient comes to you, sometimes the patient will not be eligible for the Snehana at that present. Okay, so what you should do, first you should, for example, if very obese fat person is coming, they are having lot of oil or something inside, and you really want to give an Snehana for them to do some Panchakarma procedure. But at present you are doubting whether she already have so much Sneha inside your body, like some oilness, some anxious property is there inside her body. So how can I do the Snehana again? So in the first week you can give a drying therapy like a Rukshana, opposite to that. Okay. So when you do the Rukshana therapy, it will help to open her channels little more. That is also basically a sweating therapy. When you do that, it will give little more dryness to her body, and then after that when you give ghee or oil or any Sneha, like naturally a dry surface will absorb the anxious property. So just like she can give more.
And how do you know if it should be done internal or external?
Like when we go through the Sneha Pana, I will tell in detail.
Okay.
It's all depending upon the condition of patient that we will take in detail. Okay. So next is Svedana. Svedana means fermentation. Okay. So these are the two preparatory procedure. So when you do Snehana and Svedana, so what is happening inside a patient body? See, this is a channel. Okay. See, it goes near to a tissue and the toxins are present there. Okay. When you give the Snehana, what it do? It will lubricate the channels. Okay. So when we give the ghee during the Sneha Pana, every day we will give the ghee in an increased dosage. Ghee or oil in an increased dosage till the patient body get completely saturated. Okay, that is the limit of that ghee treatment. അതായത് ഒരു പേഷ്യന്റിന്റെ ശരീരത്തിൽ എത്രത്തോളം ഘീ അബ്സോർബ് ആവോ അത്രത്തോളം നമുക്ക് കൊടുക്കാം. അതിന് പറയുന്നത് 24 മണിക്കൂർ കൊണ്ട് ദഹിക്കുന്ന അത്രയും ഘീ നമുക്ക് കൊടുക്കാന്നാണ് പറയുന്നത്. ഒരു ദിവസം കൊടുക്കുമ്പോൾ 2 മണിക്കൂറിൽ ദഹിക്കും, അടുത്ത ദിവസം കൊടുക്കുമ്പോൾ 4 മണിക്കൂർ 8 മണിക്കൂർ അങ്ങനെ വന്ന് 24 അവറിൽ എത്ര ഘീ അവർക്ക് ദഹിക്കാൻ പറ്റും. അത് ഓരോരുത്തരുടെയും ഡൈജസ്റ്റീവ് കപ്പാസിറ്റി. ചിലപ്പോൾ 300 ml 500 ml വരെയൊക്കെ പോവാം ഫോർ സം സ്പെസിഫിക് പേഷ്യൻസ്. അപ്പോൾ അതായിരിക്കും അവരുടെ സാച്ചുറേഷൻ ലിമിറ്റ് എന്ന് പറയുന്നത്. ഇറ്റ്സ് ലൈക്ക് എ ഹണി കോം. Just like the honey bee fills each and every small comb, and once it finish, every small that opening will be filled with honey. So something like that, when we do the Snehana, each and every cell should completely filled with the ghee or oil. Okay, that is how it should happen. Then that means your body is unable to absorb any more oil or any more ghee. It is saturated. If you are giving excess, what it will do? It will eliminate either through bowel, sometimes through your sweat pores, sometimes through your nose. Like it will come out as saliva. Your bowel will smell the ghee. Your sweat will be ghee. Like because it is excess, body can't absorb it. Yeah, so it will eliminate it anyway it can. Okay, അതാണ് നമ്മുടെ ഘീ ഇവർ സാച്ചുറേറ്റ് ആയോ എന്നുള്ള ഒരു സിംറ്റം ആണ് ഈ പറയുന്നത്. ഓക്കെ, മൂക്കിൽ വഴിയും വായിൽ വഴിയൊക്കെ ഈ നെയ്യ് ഇങ്ങനെ ഈ നമ്മുടെ സലൈവയുടെ കൂടെയൊക്കെ ഇങ്ങനെ വരാൻ തുടങ്ങും. സ്വെറ്റ്. ഓക്കെ, നോ ഫോർ ദ മലയാളം. മലയാളം, that is a language in Kerala.
It's a different.
Okay, so through the nose, mouth, then sweat, bowel, urine, everything will start smell the ghee. Okay, that is the time we are understanding it is saturated. Okay, so that helps to lubricate all the system. It will be all the channels in our body will be lubricated. Okay, so then next step is Svedana. So when we do the Svedana, these toxins, they are staying or they are retaining in the same place, maybe since years, maybe since many months, maybe few weeks. So they got sticky. They are unable to move from there. Okay, because of the lubrication, as the channels are got lubricated, the sweating make it liquefy. This will start liquefying and it will start moving through the channels. Understood? These toxins, see, these channels are there in brain, there in liver, spleen, pancreas. Okay, your whole body is having many micro channels. Okay, I'm not telling about the arteries or veins or nerves. These are all micro channels.
This is fermentation, right?
Not fermentation, fomentation. Fomentation of sweating. Sweating.
Fermentation.
Sorry?
F-O-R-F-O.
F-O-M-E-N. Sorry, if you're understanding my, please tell me immediately.
What is fermentation?
Sweating. Create the sweat. See, if you take a warm shower, you will naturally sweat.
Oh, you mean fermentation is waiting not let the toxin moving?
Actually, fermentation, where we are doing fermentation? On the body, externally. Okay, so what is happening inside?
Moving.
Liquefying. Toxins are getting liquefied. It will start to move through the lubricated micro channels.
So you mean that Snehana always have to come first than Sweden? Is this the order?
Actually, this is the order. But sometimes, I already told you, if the patient is unable to do at Snehana first, we want to do the Rukshana first, then do the Snehana, then
But otherwise, this should be the order. First Snehana and then Sweden.
Sweden. But see, for a patient, these are all theory. When you apply this in a practical way, it will be little bit different because we are applying it in a living body. So we need to consider their health issues, their status, their chronicity of the disease, in which level they are, whether they have the mental strength. Okay, see, some patients when we do a chamber steam, they will faint. Okay, so what we need to do? We can do just a warm water shower. Okay, it's not like, oh, I should do them some pounding, then only they will get steam. Not like that, is it? Just covering a blanket and pouring some warm water, good warm water over the body is itself a steaming therapy. Exposing to sunlight is a steaming therapy. Okay, if you are keeping one
Also, the sunlight will cause fermentation.
like, see, those who are, it's like a sweating therapy. I'm telling, these all are sweating. It's all are helping. Even a drinking warm water helps your body to be warm. That is in turn helping your toxins to get liquefied. That is why during the healing process, we are instructing the patients to drink warm water only because it will help for a day-to-day cleansing.
So can we say if we smell like a ghee, it means we are well prepared and do
Yes.
the Panchakarma?
Yes.
We smell like it.
That after ghee treatment, you should smell like a ghee, not now.
I think when we start smelling like a ghee, we can do the Panchakarma.
So Swadana, it doesn't have to be only like this kind of sauna, but it can be anything that makes you sweat.
We can do a sauna.
Sorry?
Do a sauna.
Sauna.
Sauna. Okay. That's it. How we are doing in India, maybe it will be difficult for you to perform the same way in your country. So you have to search or update it in a different way.
We need
എന്തെല്ലാം
to
ഉണ്ടാവും?
adjust
അവരുടെ അവിടെ സോണ ബാത്തോ അങ്ങനെ എന്തോ സംഭവം.
അതനുസരിച്ച് ഉണ്ടാകുന്ന
Can you explain what is sauna?
sauna
In a
is
chamber.
like you are in the very hot room and with the water steam inside,
ഇവിടെയും
then you will start
നമുക്ക്
sweating
steam
like
chamber.
Japanese sauna.
We have a different equipment. Same. See all the see mainly that what they are also doing, but in a different, which is in a room. They are in a closed chamber. Okay. So when we do the Svedana, they are getting all the toxins are getting liquefied and it will be coming. Okay, it will be moving. See, as the Snehana done, what is the privilege means? While the toxins are moving this channel, as it is lubricated, these toxins never can get stuck on the channel again. It will be full of slippery. They have to move. They don't have any opportunity to stuck there again. Okay, so that possibility we ruled out. So everything will be coming. Then where they are coming? They are coming to the common place of a gut. So it's like a water theme park. Every pipe ends in the swimming pool. You are flowing through the something. What it called? So imagine all the toxins are taking the sheet, everything is coming through the pipe and they are coming to the same pool of water. You understand that?
Yes, so you soften you first make like the channels slippery, so when you soften the toxins, they will just go into
Yes.
the channels and flush easily.
See, it's very easy to tell, but in practically it will be difficult.
So usually how long for the preparation?
But depending upon the patient. See, now we are compromised with many things. Like if the patient is telling I need a 14 days of therapy, we want to make the actually what they need, we are unable to implement like the way. We know what he needs, but if he having only very less time, if we need like if we want to do the Snehanas, Vedana and Vamana, minimum we need all the procedures and with the preparation and the elimination, minimum we need 18 to 21. Minimum.
18 to 21 days.
Sorry?
Climate condition ഒരു factor ഉണ്ട്.
That's
Climate.
very true.
അല്ലേ? എല്ലാവർക്കും ഇത് പെട്ടെന്ന് നടക്കണമെന്നില്ലല്ലോ.
ഇല്ല അതൊക്കെ എക്സ്ട്രാ അല്ലേ, ഇപ്പൊ നമ്മള് ബേസിക് മാത്രമല്ലേ
Oh, I
പറയുന്നത്.
was thinking of it 1 week. Then I need to extend.
Okay, so once it got collected, then next is just to flush it out, okay, through the very nearby opening.
And this could be like Vamana or
Yeah,
Virisa.
Vamana mostly, see, if it is an undigested toxins or something, we don't have much time, we can prefer a Vamana. In Vamana, what is happening? The medicine is not digesting. It immediately takes whatever is there. Even the toxins, sometimes it can be ama, like it is not an undigested thing. Some indigestive material can be there, something which blocks your acne, anything can be taken out by Vamana. But if you want to do a purgation or virechana, it can act only after the digestion, because while doing a purgation we need to make sure that the patient is having better appetite to digest this particular purgative medication.
Okay.
First the medicine undergo digestion, then only it can act.
Okay.
Okay. So for a patient, we are planning to give a Panchakarma. We did the ghee, everything, but at that time we are feeling like the patient is not having it's having good hunger. You can
Or it's not happening.
first you think if he is having good hunger, we can give a purgative medicine. Okay, because the purgative medicine should undergo digestion. Then only this medicine can do its own action. Okay, but a Vamana medicine, it's not undergoing digestion. Okay, even the patient is not having better hunger, don't go for purgation. Better to do the Vamana. Okay.
So for purgation, the patient needs a good acne, good digestion.
Good acne means not the very super, but it should not be very too low.
Oh, okay. Okay. I see.
So if it's you have good appetite, it means you have like a good acne. Okay.
Then only the medicine. Otherwise, if
Otherwise you
for example, we are giving Virechana medicine to one patient, okay, to induce some loose bowel.
Yeah.
Okay, നമുക്ക് വിരേചനം ഒരു പേഷ്യന്റിൽ നടത്തണം, അപ്പോൾ നമ്മൾ മെഡിസിൻ കൊടുത്തു, but the patient is not having appetite, the medicine is not undergoing digestion.
Yeah.
Okay, mostly purgation will not happen there. Okay, if there is zero acne or low acne, instead of that sometimes the patient may vomit.
Yeah. Okay. I see.
Okay, and for example, അപ്പോൾ നമ്മൾ വിരേചനത്തിന് മെഡിസിൻ കൊടുത്തു, അവർക്ക് ഡൈജസ്റ്റീവ് അവർ ഒട്ടും ഇല്ല, ആ മെഡിസിൻ ഡൈജസ്റ്റ് ആയില്ല, അവിടെ വിരേചനം നടന്നില്ല. ഡൈജസ്റ്റ് ആയാലേ വിരേചനം നടക്കുള്ളൂ, അല്ലാതെ നടക്കില്ല. പകരം എന്താ നടന്നത്, അവരത് ഛർദ്ദിച്ചു കളഞ്ഞു. ബിക്കോസ് അവർക്കത് ഒരു ഓവർലോഡാണ്. നമുക്കൊരു ഇൻഡൈജഷൻ വരുമ്പോഴല്ലേ നമ്മൾ ഛർദ്ദിക്കണം.
മെഡിസിൻ മാത്രമായിട്ട് ഓക്സിജൻ വരുമോ?
വരും, ബിക്കോസ് ദേ ആർ ഓൾറെഡി റെഡി ഫോർ ദെയർ. അത് റെഡി ആയിട്ടിരിക്കുകയല്ലേ വരാൻ, അപ്പോൾ അതും ചിലപ്പോൾ വരും. ഓക്കെ, then for a patient, we have given medicine for Vamana, but he is having severe hunger. Okay. By the time the medicine got digested, he will not hold it. He will do purgation. It can happen.
So you give medicine different to vomit and a different medicine to purgate, right?
Yeah, medicines are always different. But I am telling, by changing the condition of the patient, it can reverse. What purpose you are giving, it will not happen.
Yeah.
So this I am telling from a clinical aspect.
Okay.
Okay. So if you are giving a medicine for a patient with a severe hunger, and if he is not vomiting, you should understand that the medicine you have given for the patient got digested. So anymore, there will not be any vomit. That's it. But you need to understand.
And is also the Panchakarma related to the dosha? Like Vamana is more like for kapha disease and Virecana more like for vata disease or something?
Yeah, actually, all our cell is having these three doshas.
Yes.
Each and every cell.
Yeah, yes.
Okay, so this kapha accumulation can be happen anywhere.
And yes.
Okay, if it is in a kapha sthana, like a kapha dominant place,
Yes.
it will be much more helpful. Okay, that they will deal more detail when they take the Vamana. Okay, so each therapy is having its own specificity.
So each karma has its own specificity when you use it, for which disease. But we will see later.
I was wondering, will we practice this kind of preparation later?
Sorry?
I mean, this like a snack karma or sweat mama. Will we practice?
Practice.
Practice. Will we do a practice for this?
Here.
Yeah.
Yeah, like Abhyanga is a snehana. Taking 1 teaspoon ghee morning and evening can also be a snehana.
Oh. Okay.
Okay.
Yes, we will practice.
Okay, that see, once the theory part is finished,
Yeah.
you will start your practicals gradually, then you will get. So before that, you want to know what is actually happening here.
Yes.
So maybe then only see, if you have some stuff in your hand, then you will be getting some confusion. You need to ask. If there is nothing in your hand, you will never get confused. So you don't want to ask anything to anyone. Okay, so you need some doubts, na? Yes, of course. Okay, so these Snehana and Svedana are together called as Purva Karma. Okay. We have a Purva Karma.
Yes.
Purva Karma. Okay. This preparation. Purva Karma means preparation. Okay. Then comes Panchakarma or Pradhana Karma. This Pradhana Karma. So Panchakarma is the Pradhana Karma. It's the main.
Karma is all pradhana. No.
Pradhana Karma, see, these are 3 divisions. Purva Karma, Pradhana Karma, Paschat Karma. Okay?
Paschat.
Paschat Karma.
What is this one?
Yeah. So the preparation is Purva Karma. Like you are going for a surgery, so then you are getting admitted 2-3 days before, you are monitoring well, they are making you ready for the surgery. That preparatory procedure we call it as Purva Karma. That is Snehana and Svedana. Preparation. Yes. Understand? Next day you are eligible or you are fine for the surgery. They are taking you into the surgery room. They are performing surgery. That is our Pradhana Karma is Panchakarma. Understand? Okay. So now your surgery is over. They did Vamana, Virecana, whatever they want. Okay. So can you get discharged on the next day? Not possible. What they will do? They will shift in your next room. They will monitor. First, they will be giving you liquid food. Gradually, when your system is ready, you are able to pass your urine. When you are able to pass your bowels properly, gradually they will start the solid food. They will reduce the medicine. They will check whether your basic values are in normal range. Then maybe you can get discharged. Okay. That monitoring after the surgery is called Panchakarma. Paschat means after. Purva means before. So karma, everywhere the karma means Panchakarma. Before karma. Before Panchakarma. Paschat karma. Like after karma. That is after Panchakarma. So these are the three phases. Purva karma, preparation, pradhana karma. We do panchakarma, paschat karma. That is the after karma, we monitorize the patient. Okay, so purva karmas are snehana and svedana. Pradhana karma or panchakarma is this 5 techniques. Then what is paschat karma? Paschat karma mainly means stabilizing the Agni or digestive fire. So please understand, all the Panchakarma procedure are little strenuous for the body. It provokes Vata. Actually, some like Kashayavasti is doing for Vata elimination or Vata treatment, Vata based disease treatment we prefer, but see the procedure, okay, that process. See, you want to walk somewhere. If you are walking like normally, it's fine. If you are walking very exerted, then you get sweat, so that will aggravate your Vata. So just like this procedure is little bit aggravating Vata. Okay, so that is why after that, and it is also very strenuous for the body. It's an exertion. Okay, so after all this deep, heavy cleanse, your acne will be go down. Okay, so what we need to do? We need to improve the acne or digestive fire slowly, little by little in the during the Paschat karma time. After the Panchakarma, we want to promote the fire very slowly.
You mean during the Panchakarma, we need to improve acne and fire because
Acne fire, same.
yes, yes.
Digestive fire, we commonly tell acne. Okay, wherever you hear acne, that means if it is related with a body, that means digestive fire. Like in, I think you already got the classes regarding acne. There is fire in each and every cell. Okay, like just like this 3 dosha, Vata, Pitta, Kapha are there in each and every cell. That Pitta is somewhat like an acne. Okay, it's like a fire. Like its features, we can correlate many things. Like I can't show you it. I can correlate it, so you will get the idea. Okay, so if I am telling something and see that thing is like this a pen, so you are getting that idea. It's called Ubama. It's a similarity. Both are having a similarity. So Pitta is having a similarity with the fire. Fire you have seen.
Yes.
Pitta you haven't seen. But when I am saying Pitta is like fire, you are getting the similarity. Okay. In that way you can remember it. And it features. Like how the fire, it will be hot. Pitta is hot. Okay. We can assess the character. If it is up, it will burn. Pitta is like, when it is aggravated, we feel the burning sensation.
Yes.
So usually after the Panchakarma, the acne
Will be low.
Why will it be low?
Because of the procedure.
Because
The body gets, it's a deep cleansing.
it loses a bit of the energy, no? With
Yeah.
so much pushing
Okay.
out.
And at that time, see during the this processes, we will be giving something very light and simple Okay, and after finishing the Panchakarma also, to improve the Agni, we need to give them some specified diet. Okay, that we will take in detail later.
Okay. And for instance, like this is usually something that can take from 18 to 20 days, no?
Like whole process.
Yes.
Sometimes this preparation, I simply told you Snehan and Svedana, but we don't know how much time it will take for a patient to get that eligibility to perform the
Sometimes even more.
some 7 days, 14 days.
So how do you manage like the menstruation phase for women?
No, if menstruation happens in between, we will stop all the treatment, but the diet will continue same as the Snehapana diet, something very simple and light that we will continue. Once the her periods over, we will restart the procedure.
So it's okay just to stop the procedure and then continue?
It's a normal elimination of body.
Okay.
We can't disturb it.
Yes, it is like a Panchakarma, huh? Like menstruation.
Yes, Panchakarma in the sense, like it's a uterine cleansing.
Yes.
But I'm curious about something like I have seen that